Hello, I am Mark Thatcher, and I will be reviewing the right-click function in ViewAll. When I right-click on an image, a little submenu comes up with a few options. I will click on the Send Image menu, and it will show us different places where we can send this one image to. I could send it to a printer if I wanted to print it. I could select on Transfer Image if I had taken this X-ray under the wrong patient and need to transfer it to the correct patient. I could send it to the diagnosis view if I would like to manipulate the image. If I have Microsoft Outlook set up, I can click on Send Email and it will automatically insert this image as an attachment to an email. I could hit File Export and save it to the desktop or burn it to a disk or to another directory on my computer. I can edit the DICOM header tags, or on this computer I don't have DICOM PAX server set up, but I can click on DICOM Send and actually send this to the PAX server directly. I can copy the image, or I can click on Preview. When I click on Preview, the little Keep on Top icon comes up. This image is now on top of all other windows. I can take this image now and look at it on top of all other windows while I'm doing something else. For example, now I'm in Microsoft Word, I am still looking at the image, and I can type notes while still viewing the image. That is how we look at one image by floating it on top of all other windows. If I would like to float the entire film strip, the entire series, I can do that as well. By coming down here in the film strip to the gray area, I right-click and I click on Create Film Strip Window. Now the entire film strip is a window on top of all other applications. So I can come back into my Microsoft Word document. And I can type while still looking at the images, and I can even move the images back and forth here to look at the entire study. Another thing I can do is I can select an image, right-click it, and copy that one image. Then I can go into my Word document and hit Paste. And then I can paste that image directly into my Word document. Another nice function of the right-click is, as we noticed with this image here that I had previously right-clicked, when I go to send the image, it only shows me the one X-ray here, because in the history of this patient, Tigger, we've only taken one X-ray on this one chart position. However, in this chart position, I've taken multiple X-rays on this patient, and we can see that I have 3 X-rays here. So historically, in other series, I've taken multiple images in this one chart position for this one patient. Should I want to look at all of these images side by side, I can click on the Diagnosis View tab, and it will send all 3 of these images to the Diagnosis View, where I could do a historic comparison between all of my images. I can also use the right-click function from the Diagnosis View tab. I could click on Full Screen to promote an image up to a full screen view. Or I could go back into my Send Image menu and have all of my tools over here that I previously had in the Study View tab. Thank you very much. That is the right-click function for ViewAll. Hello, I am Mark Thatcher, and I am going to show you some of the different options that you can set in ViewAll. I will come up to the Tools menu and select on Options. When I do that, we have different icons here for different areas of the software. I'm on the General tab is where it starts. And for example, I can disable the logins when I first open the software so it doesn't actually ask me to log in. It will just automatically log me in as an administrator. I can go to the Diagnosis View, which one popular thing here is to adjust the grid layout. Currently, when we look on the Diagnosis View tab, we can see that I have 2 images showing on the large screen, but many down here at the bottom. I can actually go into the options and then change it to show 4 X-rays up on the main screen. where it will now show us 4 different images. I can also come down to the Acquire tab and change some of the default settings for the Acquire tab. I can go to the veterinarian setting and define the default provider. So for example, I will select Judy Roberts, who will now become the veterinarian of record for every one of the patients that comes into our database. And I can also change some of my DICOM settings as well. Thank you very much. Those are the ViewAll options.